Hello everyone, my name is Dr. Apar. I am a yoga and naturopathy doctor from India. As we understand, yoga as well as naturopathic medicine is practiced across the world these days. It is recognized by the World Health Organization, and large part of it comes from also the Western world, especially the North American countries. And today, to give us the perspectives and an introduction to what happens to naturopathic practice, we will be hosting Dr. Kierstin DeWitt, who is a naturopath and an acupuncturist from the Detroit area in the US. Dr. Kierstin was born and raised in Michigan area, and she graduated from the National University of Health Sciences, NUHS, uh, and then she has also specialized in acupuncture. We met basically at Barcelona in an international congress on naturopathic medicine. And during our interaction, we were very much interested in the way things are practiced similarly and differently among naturopathic medicine. And that's how Dr. Kierstin invited me to one of her sessions that she does. There is a series of YouTube as well as podcasts that Kirsten does that is called as ND Inspo, and she invited me to talk about what we do in India, and this is me returning the favor, where we have Kirsten talking about what happens in practice of naturopathic medicine in North America. I heartily welcome Kirsten for this particular program at our channel, Kalya Health.
Thank you so much, Dr. Afar. It's so nice seeing you again.
Yeah, and it's really nice that we are meeting again and talking about naturopathy. It's really lovely. So, Dr. Kirsten, we would like to know what brought you to naturopathic medicine. We start with that, and then we would have some series of questions that we would be asking you about how naturopathic medicine is practiced or learned in the North American countries.
Mm-hmm.
So,
Yeah, so for me, I started with an interest in health sciences really early on. I was involved in a lot of different sports, and so it really got me wondering about the nutrition science behind health and fitness. But on top of that, my family history was a good motivating factor for wanting to get into the health sciences, particularly type 2 diabetes and mental illness, Alzheimer's, various different things within my own family that I have seen that really drove me to want to understand the human body more and how we can really help to better understand these conditions and hopefully prevent them and treat them. Um, so those really drove me to dietetics. So that was what my undergraduate degree was in. And it also was nice because the dietetics program is essentially a pre-medical degree program, which in the United States and North America is something that you generally need to get into medical school. So if I wanted to continue on after that, then I had most of my necessary prerequisites, which we'll talk about a little bit later on as well. And so I had my dietetics degree. I was getting ready to graduate, and I just had this feeling that there was more to learn. There was still more out there that was yet to that I needed to know in the nutrition sciences. And so I had been looking up master's degrees and doctorate degrees of nutrition. And as I was searching, I came across naturopathic medicine. And so in dietetics, a lot of what we learn is the way in which food can be used therapeutically to help prevent and potentially reverse disease. And so once I learned about the naturopathic medical philosophy, which is root cause, I immediately knew that this is what I needed to go into. It aligned perfectly with my already understanding of the way in which disease can be treated therapeutically with food. And I had no idea how much naturopathic medicine encompassed, but I did know that it included nutrition. And I also knew through my clinical rotations with dietetics that oftentimes what ends up happening in hospitals, for instance, is you have to work around the doctor's already prescribed medications. However, what I learned in school was that you may not need those medications if you make the right dietary changes. So to me, it sounded opposite of the way in which we should be treating. I had the thinking that, well, if we can treat these conditions therapeutically through food, why aren't we starting with that instead of having to work around the medications? Because there's often interactions and that sort of thing. And so when I learned about naturopathic medicine, it just made sense because that is the way that naturopathic medicine works. You start with the least force possible, and then you work your way up as needed, which again, I'll go over the therapeutic order later on in this talk. But basically, I saw naturopathic medicine. It aligned perfectly with what I knew to be true for health and treating disease. And I had to take a leap of faith because unlike many other naturopathic medical students, oftentimes they enter naturopathic medicine because they've had an experience with it personally, they've been treated by it, they know a naturopathic doctor. I had none of that. I simply saw the philosophy and I took a leap of faith. I just knew that this was the right path for me. And so as soon as I learned about naturopathic medicine, I began emailing and trying to figure out, okay, what do I need to do to get into naturopathic medical school, which again, we'll kind of cover what that entails a little bit later on. And so
I think that's an amazing way. I mean, I relate to what you're talking, and I'm sure a lot of our viewers who have gotten naturopathic medicine even in India share similar stories of their own. They had some alignment towards healing naturally or something like that, or some of their family members have experienced it or something like that. So that's really amazing to know.
Mhm.
Well, naturopathy, as it is practiced across the world these days, a lot of the naturopathic practices come from America, whether it is the Kellogg or McFadden or Dr. Lindler, and a lot of naturopaths who created the base of philosophy for naturopathy. They're all from the North American part. So now, also, I think one of the four countries which impart a very structured medical program in naturopathy is the North American countries as well. So, what is it like if I want to learn about naturopathy in the US or some part of North American countries? What are the options I have? How many institutions are there? And what kind of courses can I learn?
Hmm. Yes. So this slide here is from one of our associations. And so they've kind of put together a map of all of the schools in North America. And so we have 2 in Canada currently. And then we also have, currently we have 5 in the US. However, one of them, the one in Connecticut, is is going to be discontinuing their program, and so we will then be down to 4. However, we do have a candidate school in Puerto Rico, and so we should know about their accreditation hopefully by the end of this year, and so that'll bump us back up to 5 in the U.S. And so again, so there's 2 in Canada, and then there are 5 kind of scattered throughout the U.S. And so I'm from Michigan, so I went to NUHS, which you can kind of see on the map is in Illinois, so it's just a state over from me. So that was really convenient for me. And then, as you can also see, a lot of the other schools in the U.S. are mostly on the west side of the state, and you'll kind of see that same pattern when we start to look at the licensing and regulation within these states and provinces. And then we have a school in Toronto, Canada, and then we have one in Vancouver, Canada. So they kind of have one on each side of the country as well. And
okay, so a couple of them in Canada and about 5 of them in the US is what you're telling us.
Yep.
Okay.
And then just kind of, so accreditation does matter. There are a lot of naturopath schools, and so I do want to kind of make that distinction here, because you can take, for instance, an online training, but it won't have the accreditation that these schools went through. And so these schools are accredited by the U.S. Department of Education, and then the programs are also accredited by a Council of Naturopathic Medical Education. And these really help to make sure that the training that you go through in these programs really prepares you to be a safe and effective physician. And we're trained as primary care physicians, which regulation and licensure dictates a lot of what that entails, a lot of the scope. But you, either way, no matter what school you attend, that is what your training will prepare you for. And so it's really important to make sure that when you do look at schools in North America that you are applying for, to make sure that it is a part of this this group of schools that are accredited. And towards the end, I'll have links to a lot of these associations where you can find more information on the schools, because each one does vary a little bit. And then, of course, there's location differences. So if that's something that matters to you, some people really like, California weather. And so there is a satellite school there that is appealing to some people. And so these are some of the organizations that help to regulate and also promote and just ensure that the way naturopathic medicine is practiced in the U.S. is safe and effective, and so that we can continue to grow the profession, and that we can make sure that we're putting out physicians that are going to really do well for the public. And so you were asking, do you have a question?
Yeah, I think this is very similar to the situation even in India, because there are the official programs in yoga and naturopathy, which is a 5.5-year medical program. Mm-hmm. And we do have a lot of people doing some certificate programs and diplomas, and therefore accreditation is extremely important process, be it in India or the US or the other North American countries. Mm-hmm. And it's nice that you're putting that there are the associations of the naturopathic physicians as well as the board of naturopathic education, which make sure that there is a proper channel for licensure and practice as well.
Mm-hmm. Yes, because it is a lot of work to become a naturopathic doctor. And you really start to understand why it's so rigorous once you really start to dive into medicine, because you are working with people's lives. And so taking an online course, not fully understanding botanical medicine or when a referral is necessary, these are really important decisions, that diagnostic decisions and treatment decisions that you really should only be making with the proper training. And so we just want to make sure that everyone who is treating and practicing medicine is doing so with the proper training and background. And so it is important to just make sure that and also you're spending your time, you're spending your money on learning this stuff. So why not make sure you're getting the full, the full education, right? So there's that too.
Absolutely. I mean, what you're saying is does make sense, because you're going to be dealing with lives of people. So you need to have that adequate amount of training to become a doctor in terms of either the diagnostic part or the therapeutic part, of course.
Mm-hmm.
So,
Yep.
what are the prerequisites? If say I want to come and get training in say North America, in one of these schools that you're telling me, what should be my basic qualification? What should be the education that I should have to get enrolled to a naturopathic program in North America?
Mm-hmm. Yeah. So there are a few prerequisites. So generally speaking, in order to get into an naturopathic medical school, you do need a 3 to 4 year bachelor degree, and which is, again, like I had mentioned earlier, essentially a pre-medical training. And so that often includes math courses, physics, anatomy, psychology, English and humanities, chemistry, various forms of chemistry, so biochem, organic chem, biology, and physiology. And the funny thing with the US is, and probably Canada too, but I can't speak as much for that, but there's oftentimes, no matter what area, well, no matter what school you go to, you always have to make sure that your credits transfer. And so you have to maybe reach out to the schools that you're considering, ask them if they can look over your transcripts and to give you an idea of what classes they'll accept, what ones they might not, what ones you might have to retake maybe at that school if they offer undergraduate courses, or at another school that they have already pre-approved, because sometimes that's the case too. And so mainly the reason why they do that is because varying schools will offer varying levels of education in each class. So maybe your organic chem was only a one part and it didn't cover, you didn't take two separate courses. And so the amount of education that you got may not be sufficient. And so they might ask you to retake those courses at a school that they have already pre-approved. So there's things like that to take into consideration. So even if you've taken some of these classes, you definitely want to reach out to the schools that you're considering, let them see your transcript so they can help you determine what classes will transfer and which ones won't. So even within the US, that's kind of an issue. And so I'm sure that coming from outside the US, there's, it might take a little bit of time. So consider that when you are looking to apply to schools. The other requirements, most schools require a minimum GPA of about 2.7. Some have a little bit higher of a requirement, so maybe a 3.0. It just depends on the school that you're applying to. Often they'll also require essays to various questions that they might ask, and then recommendation forms. So getting recommendations from maybe a professor that you've worked with or an employee, someone who kind of speak to your character. And then after all of that is submitted, then likely you'll go through an interview process, and they'll just ask you some general questions just to get an idea if you're the right fit for that program, and if that program is the right fit for you. So those are the general requirements, and again, it does vary school to school, and even within the different countries. So it's something that you want to kind of start early if it's something you are considering working towards, especially if you haven't yet started doing the undergraduate work. Then it's a really good time to look at what is needed before you start taking those classes, so that you don't have to double back. So reach out, take a look. I'll send some links to the associations, and they'll have more information on what is required, and also of who you can contact to get more information from each school about it.
I think I'll add all those links in the description of the video on my YouTube channel, so that people can connect whenever they require. What I see as a similarity with, and probably a little bit of difference, is that we in India also require people to have physics, chemistry, and biology as their base in their basic schooling to be eligible for the naturopathic medicine program. But also, mathematics was something that was not really required in India, which probably is one of the requirements that you're talking. Also, the GPA, the base minimum knowledge that you should have. We do have, say, the grading in terms of the 50 percentage of what you take as the base in India. So there are quite a bit of similarities in the admission process, enrollment process. But what we are more curious about is the curriculum, because that is where probably there would be some similarities, and there would be quite a lot of differences as well. So could you elaborate on what is the kind of curriculum once somebody enters a naturopathic medical school in North American countries?
Mm-hmm. Yes, and so this is also something that might vary as far as when you'll take it within the program. Some programs do have it set up a little bit differently. The class structure might be a little bit different, but generally speaking, they all encompass the same essential training, which again is what the accreditation assures. So no matter which school you go to, the essential training should be very similar. But some schools are known for other things than other ones, so there are some variants. But generally speaking, so they're assuming that you're coming in with already a 3 to 4 year background in the sciences and the health sciences, and so the first 2 years of training is really grounding yourself in those basic sciences. So anatomy, physiology, pathology or systems pathology, biochemistry, neuroanatomy, and the list goes on as far as what those basic sciences are. But then within those years, you're also beginning to dive into the philosophy and the theory of naturopathic medicine, some of the clinical skills, diagnosis skills, case-taking skills, and beginning to learn about counseling and behavioral medicine. And then, of course, we have our various modalities, which I think this is where, there are some differences between our programs and from what I understood, the programs in India. And so we do learn botanical medicine, which I know is often more so in the Ayurvedic realm, and then homeopathy, physical medicine. So at my school is also a chiropractic school, and so this was a pretty big training that we got. We learned side by side with the chiropractic students for the first couple of years of school. And so we learned a lot of really great physical medicine and manual techniques. And then, of course, nutritional therapy. And then the second half of the training. And so also after your first 2 years, after you've taken all the basic sciences, is when you'll qualify to take the NPLEX exam, which is a it's again part of what separates us from maybe an online naturopath course, is taking this 2-part exam. And so after you've taken the first 2 years of basic sciences, you qualify to take the part 1 of this, which covers the basic sciences. So oftentimes people will take that after they finish the first 2 years. So then the second 2 years, you're starting to dive into more of the pharmacology, more of the advanced botanical courses. You start to learn minor surgery, so doing sutures and that sort of thing. Business ethics, hydrotherapy is another big one that we all love, and phlebotomy, so still doing some clinical skills. And then learning more about actual diagnoses and treatment is again a lot of what the 3rd and 4th years are about. So you'll start taking more advanced case studies. You'll begin taking more clinical application courses. And then, of course, it's also when you begin to observe in the clinics. So this is when you start to be able to shadow and really get used to how the clinics work, how case taking works, and really get to observe the doctor-patient interactions. And then for our school, at least, we also did a hydrotherapy rotation during this time. And then you have a year-long clinical internship, and that is throughout every program as well. And so that is when you start to have your own patients. You're overseen by a clinician and a team of clinicians. And so this is when you really get to put all of those things into practice. And so it totals out to around 3,000 academic hours and then around 1,400 clinical hours, which is very comparable to a medical doctor or a DO or many of the other medical professions training. The differences are, so the similarities between those other programs, other medical doctors or doctors of osteopathic medicine, is the first 2 years are all the same basic sciences. The differences are, we're learning the naturopathic philosophy and theory. We're learning pharmacology just like they would be, but we're also learning the botanical medicine, the hydrotherapy, the clinical nutrition, homeopathy, all of the counseling, all of these different modalities that we do as naturopathic doctors that distinguishes the way that we treat. Any questions?
Again, there are a lot of similarities that we have in the academic curriculum, again, in the Indian as well as the way you learn. We do have for first couple of years the basic medical sciences, where we will learn anatomy, physiology, biochemistry, and pathology, and all other things that you were talking about. And then the 3rd and 4th year essentially is more clinical training. We have case studies and all of that. And at the end of it, we have an year of internship, which is essentially you are trained under a clinician. So very, very similar. Of course, we have a major portion of yoga, which I don't see there.
No,
Uh,
that was one of the reasons why when we talked in Barcelona, I was so intrigued because I really loved that element that you guys learn of yoga for the movement part. You know, we do learn physical medicine here, so we learn various manipulations and massage techniques, and there's a whole slew of PT modalities that we learn, like electrical stimulation and just various modalities that fit within the physical medicine side of things. But yoga, you're able to have them practice things at home, and of course it encompasses the mind as well, which is something that I think that our programs could develop more, which I think that they're beginning to, but not necessarily through yoga, often through different forms of meditation and some of the counseling and behavioral medicine.
yeah, I think there is always something that we can learn from each other and grow. So, could you tell us what are the basic principles or philosophies that you practice, or some more interesting experiences in the school that you have had?
Yes. So I did just want to show really quickly about the licensure,
Oh yeah.
and then I'll get into the principles. But just because we had talked a little bit about the accreditation, and so that plays into the licensure as well, which again
Hmm.
really varies state to state and between Canada and the U.S. It varies as well. So each state in the United States determines the licensure and the scope of practice of naturopathic medicine, and so again, I kind of joke that you can either go to the West Coast to practice naturopathic medicine, or you can go to the Northeast Coast, and everything in between is still a little up in the air. And so a lot of the states on the West Coast are licensed and regulated, but again, to varying degrees. And so that will determine a lot of the scope of practice, and so the modalities that you're able to use. Um, and same thing with Canada, and that also determines insurance coverage and accessibility, and to some regard. And so that is partially why, once I kind of talk about the way that I am currently practicing, it'll be very different than the way that other naturopathic doctors are practicing. And so I just wanted to kind of show this map again from one of our associations of where things are licensed and where things are currently attempting to be licensed. They're going through the process, and so they're pending, such as Michigan and Illinois, which is the state that I went to school in. And so again, licensure and regulation just really helps to distinguish our program from and the training from the non-accredited programs. And so it's often, I mean, it's really for public safety. That is the real purpose of the licensure and regulation, is just to make sure that if you are seeing a naturopathic doctor, you know that their training is coming from an accredited school. You know that they've passed those NPLEX board exams that I talked about. And so the part 2 of the NPLEX licensing exam you take after you finish the program, and then licensing and regulation again just determines the scope of practice and insurance coverage. And so we've been actively working to increase the licensing and regulation coverage for quite some time, and we've made they've made quite a lot of progress. So we're about halfway through. I think when I started, we only had maybe 18 jurisdictions in the US, and now we're up to 25. So there's been quite a lot of progress, even within the short amount of time that I've been a part of this profession. And so we're moving in the right direction. And so, yeah, so just to talk a little bit about what you were asking about the principles and that sort of thing. So as you probably know, what is naturopathic medicine? What is naturopathy? It's treating suffering according to the laws of nature using natural means. And so our principles include, first, do no harm, which is important for any medical professional. The healing power of nature, which is very specific for naturopathic medicine. It's really understanding that the body has an innate healing ability. There's an inherent self-healing process. And so if we abide by the laws of nature, if we work within those, if we remove the obstacles to cure, the obstacles to heal and recover, then we can really help facilitate that inherent self-healing process. Identify and treat the root cause. That is the main reason why I joined this profession, because it just makes sense. If you can, and this is why our intakes are so thorough and a little tedious and long. Often when you think of seeing a medical professional, it's especially in the US at least, you often get maybe 10 minutes with them. However, with us, you're getting at least an hour, sometimes 2 hours for these intakes, because we really want to understand the person's past medical history, what they're currently dealing with, and we really want to understand the individual so that we can begin to identify these underlying causes, so that we're getting to the root and we're not just suppressing symptoms. Doctor as teacher, this is another big element of what we do, which helps make it a very sustainable practice. It helps empower our patients. And so when patients and clients understand what is happening within their body, then they can better help themselves. It also helps to motivate them. And it's just a really important factor in the healing process, is understanding what is going on, so then they understand why they're making these necessary changes. Treat the whole person. Again, this is naturopathic medicine. We don't see things as systems. Even if you have maybe a nail infection, we want to know why the body is having a difficult time healing that. Maybe it's your blood sugar is too high. Maybe there's some immune system dysregulation. Maybe you're on suppressive medications. So we really want to look at the whole person, even if it is just a fingernail. We want to know why is that happening, and that's looking at the mental emotional components, that's looking at the genetic predispositions, the environment, all of these social determinants. We do not live in a bubble, and so there is a lot of factors that can impact our health and healing, and then prevention, of course. And this one, I had heard a really startling statistic. I think it was maybe 75% of what our expenditure in healthcare is spent on preventable diseases, and only about 4% of the expenditure is on actually trying to prevent those diseases. So we're putting all of our money on, we're spending all of our healthcare money on treating these preventable diseases, when we could have put the money on the front end and help to prevent them in the first place. And so, of course, this is something that I'm hoping will get more and more attention, and that we'll continue to work on in the U.S. at least. I think other countries do maybe a little bit better a job in this area, and so this is something that I hope that we really improve upon in the U.S. in particular. So those are our naturopathic principles that we learn in school, which really correlates with the philosophy of following the laws of nature and using natural means. And then here I just have the therapeutic order, which just kind of shows the way that we approach a case. And as I talked about before, we really want to begin with the least force necessary, and work our way up. So that's not to say that there might not be a time and a place for a pharmaceutical or for surgery or something that we consider higher force, but we only want to go to those means if it's extremely necessary. We want to kind of start with the least force and work our way up. And so the beginning element, which there's another image that I don't have in here of a pyramid, which I really like as a good visual of how we work our way up. And so we really want to establish the foundations, which is sleep, nutrition, exercise, breathing, all of these things, water intake, all of these things that are fundamental to our health. We want to start there and work our way up, stimulating the self-healing mechanisms. So this is often, we think of acupuncture, homeopathy. These are kind of the more energetic elements that we can work through to help stimulate the self-healing process. Supporting and restoring weakened systems. So this might be specific nutrient therapy. Maybe you need to provide some botanical medicine at this point to help to support, organs and systems that maybe are damaged or weakened. And then the physical alignment, this is where a lot of the manual therapy comes in, a lot of the physical medicine comes in. We want to make sure we address any structural components there. And then using specific natural substances. This is a little bit more of what we consider maybe granulopathy, but it definitely has its time and place of using a specific nutrient or a specific botanical for a more, so maybe you would use something very specific for high blood pressure, which before, when we were using food and nutrition, it was more fundamental. This is getting a little more specific, this for that. And then we have pharmacology, and then moving up to things like surgery. So there is an order that we follow when we're trying to determine what treatment to use when. And again, this will also be determined on your scope of practice. So not all states allow you to perform minor surgery or prescribe pharmaceuticals, but it's important to still understand so that you can refer when needed if it's not within your scope.
That's really nice way of putting it together. Again, in terms of licensure, I think we are very similar to US. There are some states in India where we are licensed through the acts, but there are certain states where still there is a process of recognition going on. We are trying, the naturopathic physicians in India are trying to have a federal licensure which would cover all over the country, and there will not be have any issues with the jurisdiction of the states. But as of now, I think we have about 16 states where we are licensed to practice in India.
Yeah.
So I think very similar tales of the way it is practiced in both of these major places in the world.
Mm-hmm.
Now, what are the kind of therapies? You did mention a few of them, but what are the kind of therapies that you practice as a naturopathic doctor?
Mm-hmm.
And what are the kind of diseases that you often get during your clinical visits, or they come to you for uh, consultations?
Mm-hmm. Yes. So just to give an idea of, first of all, what we learned. So I did go over some of this, but just to give you another idea, um, nutrition therapy, hydrotherapy, manual therapy, and other physical therapies, botanical medicine, homeopathy, pharmacology, various injections, so maybe like B12 or something, minor surgery and counseling. And then you can also do additional training, and some schools include this. So I know that you had mentioned for your training that you learn acupuncture, right?
Yeah.
And so there's actually only a couple of schools who have acupuncture embedded in the program of naturopathic medicine, um,
Hmm.
and and the other schools you can often dual degree, and so that's what I did. So I have a master's of science in acupuncture, whereas some of the other schools, again, it's just incorporated into their training. And so the reason why I like having it separate is because, kind of like homeopathy, it really is its own medicine. It's its own, it's coming from traditional Chinese medicine, and so there's a whole nother philosophy that goes to it. There's a whole nother set of history, and it really is. I hadn't quite understood how complex it was until I got in, until I started the program. But it really is a very complex and intricate system, but it can be very simple as well. But it's a really great tool, especially for things like pain. And the reason why I had ended up dual degreeing is I went down to Nicaragua. I did a medical brigade down there, and I saw um, my colleagues using acupuncture, and they had very immediate responses with it, with pain. I saw this young girl, she had extremely bad back pain, and my friend put just a couple of needles in, had her walk around, and she began crying because it was the first time that she didn't have pain. And so I just knew that I needed to learn this therapy, because naturopathic medicine can take quite some time to really get those that relief and get those benefits, because you're really really working on the fundamentals, and it takes time, but acupuncture can provide a little bit of immediate relief, and so I'm really happy to have that tool on my tool belt. But again, there are a couple of schools. I know that the Southwest College in Arizona incorporates it, as well as Boucher. And I'm not sure about the other Canadian college, if they incorporated or if it's a separate program. But it's a great tool. IV therapy is another training that a lot of naturopathic doctors do, and you can use it for a various amount of things. And again, that can be determined by the scope of practice within that state. prolotherapy, PRP. These are other kind of injection therapies, often for joint regeneration, maybe some skin type of healing. And so these kind of go over, let's see. So a lot of what I tend to work with, because I primarily work with acupuncture, and then I do naturopathic consultations virtually. And a lot of that does have to do with the scope of practice, but it's also just how I want to practice right now. I get a lot of joy out of providing acupuncture for people because of how just how beneficial it's been. So I see a lot of patients coming in with anxiety, depression. I also work at an addiction rehab facility where I do the NADA protocol with them, which is a 5-point auricular therapy. And in addition to that, I walk them through breathing exercises and some visualization, and teach them things like compassion practice and gratitude while they're in session. And so I also see a lot of infertility, autoimmune disease. I've worked with OCD, ADHD, type 2 diabetes, a lot of pain, and then a lot of other women's health conditions, which is, I think this list is fairly similar to what a lot of other naturopathic doctors work with. But really, the list goes on with what naturopathic doctors work with in the US. And so these are some of the specialties that we have now and that are kind of growing within our profession. Oncology, gastroenterology, pediatrics, endocrinology, midwifery, homeopathy, environmental medicine, psychiatry, vitalistic medicine, and generative medicine. So these are all, if you're looking to do more research or to really hone in on something, then we do have a growing number of these specialties that are forming, and so there's a lot of opportunities that are continuing to be generated by our profession, and on top of that, there's a lot of different ways that you can use your naturopathic medical degree, and this isn't just for the U.S. or for Canada. A lot of these can be done globally. So as I said before, we're trained as primary care physicians, so which is what a lot of naturopathic doctors do. They play more of a clinical role, and so you can also be a clinician or a head clinician. You can be an educator, so you can be a professor, or there's nowadays there's many different ways in which we can be educators, such as what we're doing, doing more virtual educating through various platforms. You can work administrative roles. You can be more in the entrepreneurial side of things. So working with supplement companies or online, doing online courses, or working. There's quite a lot that can go into the entrepreneur side of things. Research, that's something that we can always use more of, is researchers. Consulting, which is a lot of what I do. You can be a speaker, a writer, and then there's a whole bunch of leadership roles that go into helping to make all of those associations that I've talked about sustainable. And so there's really a lot of options. So you don't necessarily have to go straight into a clinical practice, there's really a lot of roles, and many people will end up doing quite a few of these throughout their career. I know for you, Dr. Parr, you've already done and are doing quite a few. You have quite a few hats on, and so you've already done quite a few of these. Okay.
Yeah, so what of all those things that a naturopath can do, what are you doing, and what are the experiences that you have had with? I know that you have been a very young naturopath, graduated recently, but in these years, as a student as well as a practitioner, what is the kind of practice that you do? What are the things that you follow in your practice? We would love to hear that.
Mm-hmm. Yes. So my experience has been, man. So I also have for my undergraduate degree, I also have a minor in entrepreneurship, and so that is a big passion of mine. So that's something that I had kind of started working towards my very first year out. I spent a lot of time traveling and just kind of restoring myself, camping a lot, and really working on understanding kind of the online realm and how I can utilize that to make naturopathic medicine more widely accessible, which is something that, especially now, working in both of the organizations that I currently work for are both nonprofits, which means that they're not out to necessarily make a profit like most businesses are for. They're really for the community. And again, so I work in an addiction rehab facility, and then I work in a community acupuncture clinic. And so I have a goal of figuring out how to do a similar model with naturopathic medicine, and I think utilizing the online realm and my understanding of entrepreneurship will kind of help me to get there. And a lot of the consulting that I do currently is really helping me to kind of put together programs and really really helping to kind of streamline so that I can make our medicine more accessible, because often, especially working more one-on-one, can be very costly for a lot of patients. And so I want to figure out a way to, again, just make it more accessible and affordable for some of the more underserved communities. And so a lot of that will also go play into the educator role, which I think, again, docere means teacher. So if you're a naturopathic doctor, that's kind of embedded in what we do no matter what. And so I really want to put on that hat too through the consulting, through online programs, and see how that develops as I go. Let's see. And I think a lot of the way that I practice is kind of falls more into the vitalistic role, which is really rooted in the fundamentals, which I think is a lot like how it's practiced in India. Again, still without the yoga, but it's very much rooted in the hydro, the food, and lifestyle. And also another big key to that for me is understanding human behavior, and the psychology of making those changes, because especially here in the US, and I'm sure in other countries, it's really hard to make lifestyle changes because our environment is really set up against us. You can drive down the street, and there are so many fast food restaurants. It costs more money to get a salad than it does to get a burger. It's just really unfortunate. And so I think it's really important to understand human behavior and the psychology that goes into making lifestyle changes so that I can better help my patients and clients make those changes more sustainable, because again, our environment is just really working against us here in the US. It is, yeah, it's really unfortunate, but so those are kind of the areas that I am currently interested in, and I'm sure things will kind of move along as I go, but those are what kind of spark my interest right now.
So, how do you keep yourself inspired? I'm sure there are a lot of challenges. Also, there are challenges about the licensure, the popularity of
Mm.
naturopathic medicine in US as well, which I believe are very similar challenges that we have in India as well as naturopathy and yoga practitioners.
Mhm.
So, what keeps you motivated and inspired during the whole process?
Mm-hmm. Yeah, so one of the reasons why I started the ND Inspo was to help keep myself inspired, but also because I know how it is challenging and it is difficult to sometimes remember why you're doing all of this work, because it is a lot of work to kind of be on the fringe of what is currently accepted and known. But what really keeps me inspired is I get so many patients that come in, and they're really just looking for, they're beginning to seek, and they really want to understand what their options are, which I think is just really important. It shouldn't be an either or. It shouldn't be you either go to a medical doctor or you go to a naturopathic doctor. We you know we can make such a huge difference if we begin to really integrate these therapies, because there is a time and a place, and that's the point of the therapeutic order. And so that keeps me motivated, is all of the patients that come in and they're really seeking our help. We just need to continue to put our word out there that that it's even an option. And so the other thing, of course, are all of the naturopathic doctors around the world, such as yourself, Dr. Apar. It's just really inspiring to see all of what everyone is doing in a global effort to bring naturopathic medicine to more people, and all of the research that you're doing and that people are doing around the world. And I think that is that's going to be what really brings us all together, is this this goal towards continued understanding. And we already know that that research helps to validate a lot of what we already know to be true, but it helps to validate what we're doing. And so I think that we'll continue to see more and more of that come out. And so the results keep me inspired. The sustainability of the medicine, it's so complex and it's so simple at the same time, but it can be a really sustainable medicine if we use it correctly. And that's another reason why I love it, is because of its simplicity and complexity at the same time. There's so much to it. There's so many options of how you can utilize the medicine and utilize the philosophy. And so that just means that there's endless opportunity, and there's endless learning in this profession, which excites me more than it overwhelms me. So that's always good. And again, just my own drive to want to figure out how to make it more widely accessible and known, because people are seeking out these more more natural ways of helping themselves and empowering themselves. And so there's quite a lot that keeps me inspired, and I'm sure you have some similar reasons. We all need a few, because it, like I said, it's not always the easiest path to be on.
Yeah, I think when we spoke during the session that you had with me also, I told you that, having that smile on the face of a patient,
Mm-hmm.
that's probably the driving force that all naturopaths across, taking away the sufferings from people is what should keep us inspired. Um, we would like to know more about your initiative that you have started, the ND Inspo. For those of my viewers who come from Indian areas, ND is basically a doctor of naturopathy, and that's the medical degree in naturopathic medicine that you can obtain in North America. So, Kierstin runs an initiative called as ND Inspo, and I would love you to tell us about, what exactly do you do?
Mm-hmm. Yeah, so it really started out when, well, I began kind of thinking about this idea last year, and then when the pandemic hit, I just thought, man, do we need to come together now more than ever? Because just to be able to provide inspiration to each other, to continue to keep educating and keep helping people, because we know that this virus is impacting those with underlying conditions that are potentially preventable, or they're more chronic conditions, which is really our wheelhouse. And so we really just need to continue to vocalize what naturopathic medicine is, how we can help. And so this pandemic really lit a fire under my butt to kind of get things going. And so the main thing that I'm doing with it is interviewing different naturopathic doctors, and just kind of seeing what, how they're using our medicine, how they're practicing, what things they're working on, just to help keep us all inspired and motivated. But I'm also working to, put together various resources for people. I just kind of compiled a list of botanical medicine resources, and I hope to continue to create different resources for our profession, and continue to connect with doctors from all over the globe to really understand, where we're at around the world, and how we can continue to collaborate, and to really make our medicine more well known, so that we can just keep helping people. So that's a lot of what I'm working towards, and hoping that it will continue to grow into that. So it's
That's fascinating, Kirsten, and you really have done a lot of interviews with these NDs who are practicing across. For my viewers who are watching this, I have put the Instagram handle as well as the YouTube channel of Dr. Kirsten for you over there. You can just Google it or follow it and know more about what she is doing. So she has been doing some amazing work with NDs across.
oh, thank you.
So, um, what are your thoughts, the parting thoughts that you would like to tell our viewers? Or, of course, there are a couple of questions that I'll be taking in just a minute after you have those thoughts.
um, I really think that if naturopathic medicine resonates with you, um, then I encourage you to continue the conversation. You can reach out to myself, or like I said, I will send out, I'll provide Dr. Apar with some more links of other associations that you can reach out to for more information. And so I just encourage you to get more information where you need to, and continue looking into it, because it's just such a great medicine. It encompasses so many things, and you'll never get bored. That's 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 what I can say with that. You will never get bored. And so if this is a passion that you have, like I did, that will carry you through your training. What I will say is, if you're doing it because you want to just have doctor in front of your name, that's not going to be enough to keep you motivated. So just, make sure that you're doing it because you truly believed in the philosophy of, abiding by the laws of nature, and using that to help prevent and treat disease. And that's what's going to keep you true to the roots of naturopathic medicine, and help you through the rigorous training, and really help you through those. Sometimes there's some long days when you're working in a clinical setting or whatnot, but if you truly believe in the philosophy, then that will really keep you going.
That's really nice. That you're so inspired about naturopathic medicine, and you want to go on doing the service for the mankind using this noble profession. There are a couple of questions from the viewers who are watching us on YouTube, and both of them are aligned in a very similar manner. That is, if a naturopathic doctor who is trained in India wants to come to US and start practicing there, what would be the procedure, or whom he should reach out to, and what are the kind of training that they may have to undergo, or so those kind of things. So
Okay.
if you can just throw light on someone who is traveling from other parts of the world to US with training in naturopathy, uh, what should be the way forward for them?
Okay, so there is an association that I think could be helpful to answer some of those questions, because some of the schools, so some of the states may may recognize the program, but because of our accreditation, and because of the legal issues within each state for licensure, it's likely that you would have to maybe do a little extra training at one of the naturopathic medical schools in North America. And so I would I'll provide, again, I'm going to provide the links to the associations so that you can really help to verify what further training you may need, or to see if maybe that state association, if there's a specific state that you're interested in practicing in, reaching out to that state association to see if they would recognize your training, because this has been kind of an issue for, same thing with acupuncture, even medical doctors, is recognition of the programs globally within the US, just because of our accreditation and the requirements that each school has to follow and each program has to follow. And so, again, they just have to make sure that the program that you've attended qualifies for what is required here in North America. And so I'll provide links to those associations. I'll give those to Dr. Apart to share with you and to put in the description so that you can reach out and, they might ask for your transcripts, or they'll be able to give you a little more specific information on what that state requires. Because again, it does vary state to state. There are the what we call pre-licensed state or unlicensed states that don't currently require that training or that licensure, but they still have associations. And so even if you're planning on moving to one of those pre-licensed states, I would reach out to their specific association. Most states have their own association where you can get more information on what they require.
Yeah, probably there is one very specific question about a particular state in the US. It's about Tennessee.
Oh, okay.
So if I don't know if you are aware of what the rules are at Tennessee, but if you can just throw light on whom one of my friends who is there now can reach out to.
Okay. So Tennessee is currently not regulated, but they are in the process of being regulated. And so even so, if you're practicing, and that's the other thing, if you're currently practicing in a unlicensed or pre-licensed state and it becomes licensed, then you'll have to apply for that licensure. And so you'll still want to make sure that you have the adequate requirements for that state. And so because it is currently being they are currently working towards licensure, they likely have a association, and they do. And so I will send that link over to Dr. Apar, and he can go ahead and share that with you. And that should have more information on what they require and what their scope that they're applying for is going to encompass, that sort of thing. Because, like I said, each state is different, and we currently have 25 that are regulated in the US. So I don't know for each 25 states, what their scopes are or what they're pushing for. But I've sent over that link to that association. So Dr. Park can go ahead and share that with you.
Yeah, I have shared that on the YouTube chat for Dr. Sindhu, who is in Tennessee.
Okay, great.
Thank you so much, Kierstin, for that. And this has been a really nice initiative that you began, calling the naturopathic doctors from across, and then putting them together, discussing about what inspires them, and how exactly do you grow further in the times which is difficult for not just naturopaths but for the entire world. This pandemic has been really a challenge for all of us. So Kierstin, thank you so much for joining us on our program here and giving us an idea. Probably there would be details, there would be a lot of information that is there. We're talking about practice of naturopathic medicine in a entire continent.
Yeah.
So I'm sure it is very difficult for us to uh, cut it short in a span of an hour or so. But
Mhm.
thank you so much for making that information concise for our viewers, and thank you for joining us. There is a lot of time difference, so I would say good evening to my viewers, and you would say have a good day because you're starting your day there.
Yeah.
So thank you so much for joining us. Anything that you would like to convey to our viewers as parting thoughts?
No, just thank you so much for having me on and allowing me to talk about what things are like here in the U.S. I think even for people who are starting out in the U.S., this is helpful information to them if they're considering naturopathic medicine as a career. And so, thank you for giving me a chance to talk about it because I do love our profession and I think that there's so many opportunities and just a lot that we can do to really help the world with naturopathic medicine. And Dr. Parr, is there anything else that you've thought of that keeps you inspired in naturopathic medicine?
I like teaching, and my students are my inspiration. A lot of times, I learn a lot of things from them.
Mm-hmm.
I learn with each patient. It's a new learning because each one of them can teach us more than any of the books that teach us anything.
Yeah.
So that is something that is really fascinating. The other motivation that I have is the way uh, naturopathic medicine or yoga um, changing the whole uh, perspective of how your body and mind works. And being in research gives me an opportunity to explore those areas. So there have been these wonderful things that I probably I am able to do because I am in an institute where I'm able to do the academic part, the clinical part, as well as the research part. And each one of them is so much of an inspiration, keeps me going.
Yeah, I know you really do. You really do it all. It's so great. Definitely inspiring.
Yeah. So thank you so much, Kirsten, for joining us. And thank you to all the viewers who were watching us live on YouTube, as well as the entire stream will continue to be there available for you to watch later on. The information that was given by Dr. Kirsten, I will make it available in the description of the video so that those links you can utilize and explore further. And probably we will have some subsequent discussion on more specifics in the days to come. Thank you so much for joining. And if you have not subscribed to our channel, please do subscribe. My channel, you can subscribe the ND Inspo channel of Dr. Kirsten and follow the videos that she puts in and be motivated, be healthy, be happy. Thank you so much and have a wonderful day.
Thank you.